So now we will discuss general approaches to neurotransmission in autonomic nervous system. As we said, we have two divisions. We have parasympathetic nervous system and we have sympathetic nervous system. Preganglionic fibers of sympathetic nervous system and parasympathetic nervous system release acetylcholine, because we have ganglion, and we have postganglionic fibers. So this is a ganglion, is a place where we have communication between neurons. This is a ganglion. So inside ganglions, preganglionic fibers of sympathetic nervous system and preganglionic fibers of parasympathetic nervous system release acetylcholine. And acetylcholine interacts with an subtype of receptors on neuronal cells. Neuronal subtype of receptors. Also, we have acetylcholine esterase here, and this acetylcholine esterase is responsible for acetylcholine breakdown and degradation. Postganglionic fibers of parasympathetic nervous system release acetylcholine also. And this acetylcholine degrades with help of acetylcholine esterase, and acetylcholine interacts with M1, M2, M3, M4, M5 receptors. It'd be nice if you will know just three of them, M1, M2, M3. It will be enough. So, once again, preganglionic fibers of parasympathetic nervous system release acetylcholine. This acetylcholine interacts with an subtype of cholinergic receptors, and postganglionic fibers of parasympathetic nervous system release acetylcholine also, and this acetylcholine interacts with M1, M2, M3, M4, M5 receptors. As we're talking about sympathetic nervous system, preganglionic fibers of sympathetic nervous system also release acetylcholine. Acetylcholine interacts with an type of receptors, degrades by acetylcholine esterase, and postganglionic fibers of sympathetic nervous system release norepinephrine. And this norepinephrine interacts with alpha-1, beta-1, beta-2, beta-3 receptors, and alpha-2 receptors located presynaptically. Degradation with help of monoamine oxidase plus catechol or methyltransferase and reuptake. What is interesting? Interesting that we have few exceptions for sympathetic nervous system. Let's have a look. These nerve terminals that release acetylcholine called cholinergic. So preganglionic fibers of parasympathetic nervous system are cholinergic. Preganglionic fibers of sympathetic nervous system are cholinergic. And postganglionic fibers of parasympathetic nervous system also cholinergic, because they release acetylcholine. Postganglionic fibers of sympathetic nervous system are adrenergic. Postganglionic fibers of sympathetic nervous system that innervate sweat glands or thermoregulatory sweat glands also release acetylcholine. And this acetylcholine degrades by acetylcholine esterase. So we should remember that postganglionic fibers of sympathetic nervous system release acetylcholine in case of innervation of thermoregulatory sweat glands. Preganglionic fibers of sympathetic nervous system that innervate adrenal medulla also release acetylcholine. And as a result of rising in sympathetic nervous system tone, preganglionic fibers release acetylcholine to adrenal medulla. Acetylcholine interacts with AN type of receptors, and in response to that, adrenal medulla releases epinephrine and norepinephrine into the circulation. Again, 80% of epinephrine and 20% of norepinephrine. Most likely, you heard that in the lungs we have beta 2 receptors. Yeah. When we're talking about lungs, of course, we're talking about smooth muscle cells in the lungs, and most likely you heard that. You heard about that. But here is my question: how does these beta 2 adrenergic receptors in the lungs are innervated if we say that norepinephrine as a major neurotransmitter and norepinephrine does not interact with beta 2 adrenergic receptors? The answer is that epinephrine from systemic circulation produces action on beta 2 adrenergic receptors in the lungs and causes bronchodilation. Sometimes you can meet information that muscle erector pilia innervated by cholinergic fibers, but in muscle erector pilia innervated by cholinergic fibers and coming from sympathetic nervous system that release acetylcholine, and also innervated by adrenergic fibers, postganglionic adrenergic fibers that release norepinephrine. So I would like to put muscle erector pilia here, and would like to show two types of receptors, the alpha-1 receptors and M3 type of receptors. Yeah, and more norepinephrine are responsible for innervation of muscle erector than acetylcholine. Just keep in mind that. Okay, next.